Good morning, everyone. Thank you so much for being here. Welcome, welcome. I know it always takes a minute for folks to trickle in from the waiting room, so I'll give it just a moment and then we'll kick things off. But so glad that you're here today. All right. I think that we have the majority of the waiting room is here with us, so I'm going to go ahead and kick things off. Good morning, everyone, and welcome to the morning meeting. It is September 25th, 2025. I'm really glad to be here with you this morning. My name is Caitlin Feldman, and I'm the Senior Director of Policy with Groundwork Ohio. I am so thrilled to have the opportunity to introduce our guest today, Maleka James. But before I turn it over to her to share more about her work, I want to give some updates from the Groundwork Ohio lens, and starting first with where things are with federal budget update. So as of today, again, September 25th, Congress has not yet reached an agreement to fund the federal government for the new fiscal year, which does begin October 1st. The House actually recently passed a short-term funding bill known as a continuing resolution. You've probably seen that in the news headlines, and that would keep the government open through November 21st of this year. But earlier this week, the Senate rejected that proposal by a 44-48 vote, and it would have required 60 votes for that to advance. So Senate leaders are now working to negotiate an alternative plan. They do have some key disagreements around overall spending levels, but also policy priorities. And some of those policy priorities do impact maternal, infant, and child health. One of those things being the enhanced ACA premium tax credits. Those are currently set to expire at the end of 2025. That is a key sticking point for the Democrats. And so if Congress does not pass either a continuing resolution or a full year appropriations bill by 11:59 p.m. on September 30th, there will be a partial government shutdown beginning October 1st, that start of the new fiscal year. So that could also disrupt some critical programs and services for kids and families. So the next several days are really going to be pivotal as those negotiations continue. We actually, several members of the Groundwork Ohio team, we're planning to join the Ohio Head Start Association and First 5 Years Fund in DC next week. That trip will be Tuesday and Wednesday, so we couldn't have planned it any better to kind of be there in the thick of things when all those conversations are happening. We have some meetings set up with members of the Ohio congressional delegation to talk about and to really advocate for the adoption of increases to CCDBG funding and Head Start and early Head Start that was included in the Senate's version of the bill. So be watching us on social media for real-time updates. That'll be, again, early and mid next week. And all this stuff happening on the federal level, we know that folks are really curious about this and might have a lot of questions about this. So we are thrilled to be able to share someone that's got a real solid grasp on some of the inner workings of the federal budget spending and all the processes there. Her name is Samantha, and she is with the 0 to 3 team on their government relations team. And she is going to be our morning meeting guest next week. So wherever things land, she is going to be here to kind of talk it through, to answer questions. So if you have that curiosity around the federal budget, please feel free to join us next week with all your questions, and she'll be able to have some answers. One final thing before I transition over to our guest, I want to mention that Groundwork Ohio has our Momentum Institute coming right up. So this is an all-day event that will be held in Dublin, Ohio. If you're not from the Central Ohio area, it's kind of just outside of Columbus on the west side. And it will convene early childhood leaders and experts and families from all over the state for a full day of learning and strategizing around how to continue building Ohio's early childhood movement. My colleague Jacob, I believe, just dropped a link in the chat. If you're not registered already, please feel free to do that. And now, so September is Infant Mortality Awareness Month. And to round out this month as our final morning meeting of September, I am really thrilled to introduce today's speaker, Maleka James. Maleka is the Infant and Child Wellness Initiatives Project Manager at Dayton Children's Hospital, where she's leading cross-sector efforts to reduce infant mortality and improve maternal health. You'll probably remember many updates from the Groundwork Ohio team during our last morning meeting series during the state budget, where we were highlighting and keeping you updated with those real-time updates about funding that was on the table for those community and faith-based infant vitality funds to reduce infant mortality at the local level. Those funds were approved in the state budget at $5 million and are now being rolled out in select local communities, with Dayton being one. So Maleka, I will now turn it over to you to take the floor and share more about this work that you are leading locally. Thank you so much.
All right, thank you. It took me a little minute to get off of mute. Can you see my screen?
Yes.
Okay, great. Thank you so much, Caitlin. Good morning, everyone. Just wanted to first off thank the Groundwork team for just creating this space and opportunity to share about our work, and for inviting me to speak on today's morning meeting. Again, as Caitlin mentioned, my name is Maleka James, and I serve as the Infant and Child Wellness Initiatives Project Manager at Dayton Children's Hospital. And I am super excited to share today about the Partnering for Change initiative. This is a collaborative effort to reduce infant mortality. And as you're reducing infant mortality, you're also improving maternal health outcomes. And this is an initiative across the state of Ohio. So there is a lot as it relates to this Partner for Change initiative. I know I have a short period of time to talk about it. As we move forward, I'll be open to any questions that you have along the way. So what is Partnering for Change? So this is a statewide initiative that is supported by Governor Mike DeWine, the Ohio Department of Children and Youth, and Cradle Cincinnati. And so I'm sure many of you have heard of Cradle Cincinnati, but this work is really looking to replicate the work that Cradle Cincinnati has done across these different areas in Ohio. So it's being implemented in Cuyahoga County, Franklin, Lucas, and in Montgomery County. And these are areas that unfortunately have some of the poorest birth outcomes across the state. And so here in Montgomery County, preliminary data from 2024 shows that the infant mortality rate was 7.4 deaths per 1,000 live births, with an unfortunate 44 infants lost. And so we know these numbers are devastating and really show the urgency of this work. And so for this initiative, Dayton Children's, we do serve as the backbone agency in Montgomery County. And what our role is to really coordinate the efforts across our county to build partnerships and to drive systems level change. And, part of this is to have a good team that we're working with to help us move this work along the way. And so this work is guided by a project leadership team that's not only made up of Dayton Children's folks, but also community organizations and members that bring their lived experience, their expertise, and their commitment to maternal and infant health. And I think their leadership really ensures that our strategies are rooted in community priorities and equity. So we have public health, we have the Greater Dayton Area Hospital Association, the Dayton Children's Hospital, Queens Village Dayton, which I'll talk a little bit more about here shortly, and a few community members that are a part of that leadership team. We also have an OBGYN that helps us as well. And he was part of the work that started out in Cradle Cincinnati, and he's helping us lead this work as well. And so as we are learning the Cradle Cincinnati model, they are walking alongside us and the other three grantees to help us really learn what their ingredients were to help them to become successful in reducing their infant mortality significantly. And so our work is grounded in 4 principles that are adapted from Cradle Cincinnati's successful model. And it first starts out with data access and utilization. So what we do is we're really looking to use data to identify the disparities, track progress, and inform decision-making. So Dr. James Greenberg is one of Cradle Cincinnati's co-founders. And when we explored this with him in more in depth, he really emphasizes the need for timely, community relevant data that really helps us answer the real questions as why are infants dying? Where are they dying? When are they dying? And most importantly, how can we use this data to actually help families? And he challenged us to really move beyond the traditional systems like the ICD-10 codes and really create categories that make sense at the community level. So I think, in terms of those who are really in the data world, ICD-10 codes and DOLPHUS, they make sense. But when you're trying to share this information out more broadly into communities, we have to break it down a little bit deeper. And so I think this shift is going to be critical if we want to make data actionable and meaningful across the board for everyone to really be able to understand. The second component is focus, 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 making sure that we're focusing on the leading causes of infant mortality. And one of the things that Cradle Cincinnati has done to really help us think about this in a different way is to explore 4 criteria that can help us design better interventions. And that is one, timing. So are we intervening early enough in pregnancy to prevent preterm birth, which we know is the leading cause of infant mortality? Location, are we targeting high-risk neighborhoods and or zip codes with the greatest needs? There are some areas that may need a little bit more to get further along the way. And then also plausibility. Are the strategies that we're implementing, are they grounded in evidence? And then lastly, feasibility. Are we evaluating interventions in a way that lift up lived experiences and not just numbers? So we're taking all that and thinking about and how we can move forward and not just doing something, but doing the right things in the right places and at the right time. So that's why focus is important in this work. The third component or the ingredient is collective impact and community engagement. We talk a lot about collective impact across the board. And we know this framework isn't just a buzzword, it's really the structure that really helps us to work better together. So do we have a common agenda? Are we sharing measurement and data across our systems? Do we have mutually reinforcing activities? Are we open and do we have continuous communication? And that is the work of this backbone organization to really make sure that we are the ones that are continuously communicating with our community partners and coordinating the efforts across our community. And one of the ways that we're doing community engagement is through a group called Queens Village Dayton. And so many of you may have heard of Queens Village that was birthed out of Cradle Cincinnati. And this is a powerful network of Black women who gather to support one another. They advocate for change and elevate their voices in maternal and health conversations. And so Queens Village, I think they've really shown us what real engagement looks like. What they do is provide stress reduction among pregnant and birthing families, leadership investment, and advocacy, and they're grounded in community wisdom. And so we're using Queens Village to really help us lean in on what are the experiences of women that we may not know about that we need to implement into our programming moving forward. And so the fourth part is building learning collaboratives. And so, this is I think a sweet space for us as we get to building the learning collaboratives. We're going to be building spaces where providers and healthcare professionals really come together to transform prenatal care. And using this all teach, all learn model, how are you doing one thing in your organization, or how are you applying quality improvement within your networks? What things are working in your space, and how can we scale that across our community? And so that's another space that we'll be venturing into as well. And so we know that collaboration is key. And I think this diagram really helps to represent the collaborative ecosystems that we're building. It is a community-centered model where these 4 sections or sectors work together to promote maternal and infant health wellness. So at the center is health and wellness. This is the shared goal that unites us all. This is not owned by just one group. It is co-created and sustained by all. And surrounding that center are the maternal and infant health care providers. They're the ones that are delivering clinical care and support during pregnancy and birth and postpartum. And then on the other side, we have community public health. They are driving population level strategies and health equity. And then we have the community, and in this case, Queens Village as part of that community, and other community organizations that are really representing lived experience, leadership, and cultural wisdom. And so what I take from this slide is that each sector is an equal distance from the center, and it shows that no one voice dominates. And I think this bidirectional arrow reflects the ongoing collaboration, feedback, and mutual influence from the community to really shape how we move forward in our initiatives. And I think, like I said before, Queens Village really shows us how that connection can be built. And it's not just by sharing information with community, but by learning from community. And that's how we build the systems that truly serve. And so that is what we're doing. And so the last part, as we move forward, we are going to remain grounded in the belief that strong community partnerships are really essential to improving maternal and infant health outcomes. I think this initiative is not just about reducing infant mortality, it is also about really building the systems that listen, learn, and respond from the voices of women and families across our community. I think we know that shared leadership between healthcare, public health, the community is how we move from intention all the way to impact. And we're committed to using the data that is timely, relevant, and actionable, not just for institutions, but for families and communities who deserve answers and solutions. We've had a lot of community conversations across our community, one of which have been Groundwork Ohio, which Dayton Children's was fortunate enough to participate in having a small group of women and learning about what do they need. And we really want to respond to the things that our women are continuously saying that they need moving forward. And with that, recognizing that community voice is central, it's not optional, it must be embedded in every decision, in every strategy, in every outcome that we pursue. And like I said before, this work is about doing the right things in the right places at the right time, and ultimately doing this together. And so that is the work of Partnering for Change. I don't want to say we're just getting started. We've been working in the maternal and infant health space for quite some time. Although we are a children's hospital, we still work with babies and infants. We don't deliver here, but we are coordinating with our adult hospitals, hospital association, and public health to make sure that we are meeting the needs of our community. And so while this Partnering for Change initiative started back in April, we are applying, again, the work of Cradle Cincinnati to help us think more strategically, think more inclusively in the work that we're doing so we can see a change in our community. We know that for Cradle Cincinnati, they've been working for the last 10 to 15 years. So we know that the infant mortality crisis in Montgomery County didn't happen overnight. And so it's going to take time for us to see change. But we're committed to that. And I do appreciate the work of Cradle Cincinnati and how they are walking alongside these communities to help us think about how we think about data differently. How do we think about involving community voice along the way? And more importantly, how we are building trust with our system. So how are we building trust with healthcare providers and also community members in order for us, again, to see positive change in the future? And so with that, I do leave plenty of time for any questions or comments or any thoughts as we are venturing into this Partnering for Change work. For those who have seen successful strategies in their communities, what have worked well for you also? So that's a question for me that I have for you all, but I'm open to answering any questions that you all have as well.
Thank you so much, Maleka, for that really fantastic overview and for the work that you're doing. Folks, if you do have questions or response to Maleka's prompt around what you are doing in your community to support this space, feel free to pop off mute and drop things in the chat. This is informal conversational, so feel free to jump in and I'll kind of give you a moment to think and ponder. Malika, I do have one question if folks are typing or thinking.
Sure.
I know that the Cradle Cincinnati model is not meant to be too prescriptive to the communities that it's expanding into, but really more of giving some of the foundational principles of where they started and how they found success, and then sort of giving the keys to the castle, right, to those folks that are
Yes.
participating in the Partnering for Change. So I'm just curious about your thoughts on that, and how you went around, or how you went about selecting the members for your leadership team locally, and why you chose those partners.
No, that's a really good question. I wanted to touch on your first point about this not being prescriptive, which I really do appreciate. Not everything that works for one group works everywhere, but I think sharing, like I said, like those key ingredients that have been um, used to drive change in their community, I think that's really important. And so there have been lots of talks about, they have what's called Mama Certified, like this rating system among hospital systems to better serve their patients. They have Queens Village Corners, spaces for Black women to feel seen, heard, and valued in the hospital. And so that while they're not saying this is what you have to do, they have shown success. And those are some key considerations that we've thought about in our community. For the project leadership team, we're continuing to grow. I mean, we started out small, but we wanted to make sure that we had uh, individuals that have been part of this work, that can really help us mold this work moving forward. And as I mentioned before, it was really important for us to have members of the community part of that. So we have a few members of the community that help us and guide us along the way. We also have a community doula, that's part of our project leadership team. I think when we have talked in, I want to say the Groundwork Ohio conversation and also across our community, there's been lots of conversation on how doulas are really important in this work. And so we really wanted to make sure that we had that representation as part of this. We have public health. That's a key partner in the work. They are really helping us to look deeper into the data. And they've been in the maternal and infant health space for a long time. And we wanted to make sure that they were part of this group as well. I think another addition to this was, again, going back to Cradle Cincinnati and the early partners that really helped move that work forward. One of the OBGYNs who was part of that work is also part of our project leadership team. And he really helped us to really understand some of the foundational principles, in particular, the learning collaboratives, how those have been successful in Cradle Cincinnati, and really having that all teach, all learn model and conversation among healthcare professionals and providers. It was successful, and he's really helped us to really understand that a little bit more clearly. One of the community pediatricians that's at Dayton Children's Hospital, he has been a community provider for the last 30 years in Dayton, and has a wealth of knowledge and expertise in this area. We also have the Greater Dayton Area Hospital Association that has been a huge partner since the beginning. And so, and like I mentioned before, Dayton, Queens Village, Dayton. So our project leadership team continues to grow, and it's really like the day-to-day activities of the project. But we also we have met with other stakeholder groups to also gather their voices and input along the way. So that's kind of a little bit more as to why we have this or chose those who are participating in our project leadership team. But again, this is not the end all be all of the project leadership team. We have continuously added members, and continuously had conversations with others along the way. So we don't walk people down with extra meetings, but we're making sure that we're getting to everyone that we can.
Thank you so much for that. I appreciate your overview too about how you're working with that OBGYN on your team and that pediatrician on your team. I think it's certainly known that the folks working in the medical community that have high patient caseloads, that the demand on their time is just so great. And so I know that they're often strained for capacity to participate in
Yeah,
additional opportunities like this. And it's just, what an impact they can have in supporting and guiding the work and adding insight and context when they are having so much of that interaction with families day to day, and can sort of provide guidance and insight from that medical perspective, as well as the family informed perspective too.
absolutely. The other part I was going to touch with that, kind of going back to Cradle Cincinnati and their motto, it started out with OBGYN and a neonatologist. And, one of the things that they've done and spent a lot of time is going through the cause of death process and looking a little bit deeper into, again, going into where the infants are dying, why are they dying, at what point are they unfortunately dying, and it's going a step further. And that is what we are ultimately looking to build here, is to have a core group of individuals, so a neonatologist, an OBGYN, and the maternal and child epidemiologist, to look at each and every case of infant death, to really pinpoint a little bit deeper for us so that we can tailor our interventions a little bit more focused, and making sure that we're in specific areas that needed the most. So again, I think there are a lot of different principles that we can take from Cradle Cincinnati. And it's just really thinking about how that's going to take shape here in Montgomery County. It may look a little bit different, but I think a lot of the things that they've shared with us, we're really open to trying. I think, what we have seen is that, doing the same thing over and over again and getting the same results, that's insane. And so we're trying to look at this in a different way. And we want to continue to uplift the work that has been done in Montgomery County. There has been some great work here locally, and also looking at it, what can we do differently to achieve a different result? And I think going about it that way and looking at the cause of death process in a different way can help us achieve a positive outcome.
Absolutely. Thanks, Maleka. We have
You're
just a
welcome.
few minutes left. Are there any other burning questions or thoughts from the audience before I close us out?
Hi, this is Ellen from Lucas County. I just wanted to thank Maleka for sharing that wonderful summary in Partnering for Change. I'm one of the key agencies here at Lucas County with that team as well. So it's just really nice to hear a summary from another perspective, but you guys are kind of on the same track that we are. So thank you so much for that summary and sharing with the group. I appreciate it.
Absolutely. Thank you for being a partner in this work. And I think that just goes back to the name of this initiative, Partnering for Change, which I think is so important to continue to highlight that we cannot do this alone. Not one single agency can. And so really thinking about how we can spread our wings amongst our community to make sure everyone is included in this work.
Mhm. Thank you, Ellen. Thank you, Maleka. If there are no additional comments or questions, I want to just give another huge thank you, Maleka, for sharing your insights, your perspective, your work. We're so excited to continue following the work that you're doing there locally and stay in the loop with all the amazing things that I know are to come from your leadership team, from your leadership to support the community and reduce infant mortality in your area. Thank you for joining us today as a
Thank
guest.
you.
Really appreciate you.
Thank you all. I really appreciate your time.
Thank you, everyone, for joining today's morning meeting. We look forward to seeing you next week to talk about all things federal budget in great detail. Have a great rest of your day. Thanks so much.